Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 146,663 confirmed cases of COVID-19 in Canada and 47,752 cases in Ontario. Chatham-Kent has 366 cases, and Sarnia-Lambton has reported 344 cases. Michigan now has 117,910 cases, with 14,238 cases being in Detroit. Today, we are reporting a total of 2,636 cases of COVID-19 since March, an increase of 2 cases from yesterday. Both people work in the agri-farm sector. 2,475 cases are now resolved, and 85 cases are active and being followed by our health unit. 4 people are in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There is currently 1 retirement home experiencing a COVID-19 outbreak. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. Parents are encouraged to use the ministry's assessment tool, which can be accessed through our website or ontario.ca. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Windsor-Essex has 3 assessment and testing centres, which include St. Clair College Sportsplex, Windsor Regional Hospital Aulette Campus, Erie Shores Healthcare in Leamington. And SOHAC in Windsor offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to quick access online, you may receive your result before the health unit contacts you. As schools reopen, one of the biggest changes is the use of online learning. We recognize that teachers play a key role in supporting students to make connections between what they learn in the classroom and their own lives. This is why we have added a new section on our website for local educators, which has links to lesson plans, toolkits, and other ideas for teaching curriculum in fun and engaging ways. Each curriculum resource includes alternatives for online learners and suggestions to engage the whole family. The site includes resources on topics including physical activity, healthy eating, violence and bullying, and mental health, and will be updated regularly with new resources and topics for health and well-being. To access the new portal, educators must register at www.wechu.org/educators. Please continue to visit our website at wechu.org for the most current information on schools and workplaces. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
Good morning, Teresa. Yesterday, Premier Ford spoke about an enhanced flu shot campaign this year. I'm just wondering what role, if any, public health will play in executing that campaign and pushing the message for everybody to get their flu shot.
So as we have every year, the health unit is part of the provincial campaign and also provides communication locally to our healthcare providers and our general public. So we will definitely be advocating for everyone to get the flu shot. We are the distributors of the flu vaccine to area healthcare providers. And we do fridge inspections for the pharmacies that are participating in the program as well. But our health unit will definitely be advocating and be promoting the general provincial messaging, which is basically get the flu shot.
And just to go off of that, I know last year there was a bit of a shortage at the beginning of flu shot season. Do you know if there's going to be enhanced preparedness this year and making sure that there's a excessive quantity available, or is it too soon to tell that yet?
Well, we do know that we have been told that we'll probably get our flu vaccine mid-October, which is typically when we do receive it, and initial flu vaccines generally go to the most vulnerable, which is those immune compromised and those the elderly or patients that have conditions that would require a flu shot in advance of the general public. So we haven't received any information contrary to any shortages or anything like that.
Thank you.
Any questions from CBC?
Yes, good morning, Teresa. Just wondering, lately, how many test results are coming in each day, and is there a change there?
So the health unit receives the positive results, and we do have access to negative, but I'd have to look to see exactly how many are coming every day. But I know that our area, we were doing, around 500 a day at one point, but I'm not sure what it is this week. It does change from week to week.
I'm just wondering if we're seeing lower cases because we're not doing as much testing right now.
Well, the testing is necessary to get the results, but we do hear from our assessment centers that they are busy, but we have weekly reports, and so I'll have to follow up on that and give some more information regarding the actual volumes that we're seeing in our community.
Okay, thank you.
Any questions from AM 800?
Hi, good morning. I'm just wondering if you have received any complaints as it relates to operations of local schools, similar to how, somebody would maybe file a complaint about a restaurant or a commercial business.
No, we have not received complaints about schools. We do have regular communications with the school boards, and as you know, our nurses are working directly with the principals. If there is increased absenteeism in the school for any particular reason, we do have a protocol in place that typically involves more communication with the school. But specific complaints, we haven't received any complaints to my knowledge about the schools.
Okay, so I guess is it fair to say then that since the return of school that you are happy with how things have been going in the schools in that aspect of, the cohort staying together and the cleanliness of the schools and the nurses' communication and everything?
Well, I think there's always room for improvement, and I think our health unit, we're going to continue to work on the communication piece and try to make sure things flow smoothly. It is early, it's still early days. We will address things as they come, but so far we are just trying to perfect some of the policies and protocols we have established and make sure that the schools are supported the best way that we can support them, and also the parents and caregivers of the children. So it's still early yet, but I think our community, our schools, they're doing a good job with, in these early days.
If a parent does have a concern about something they've heard or seen happening in a school, are they encouraged to contact the health unit? Is that the best way to handle it?
They can talk directly to their school. I would say that if they do have a concern, they probably should bring it forward to the principal of the school. But if it is an issue, we do have the hotline, like a school hotline, extension 1555. We also have a information line and regarding COVID, and primarily a lot of questions that parents want are probably around their child having symptoms and whether they should be going to school and what's the process. But I would say start with the principal, but specific issues that aren't getting resolved that the health unit may be able to assist with. We're in communications with the schools, so if anything's brought to our attention, we would bring it back to the school.
Okay, thank you.
Any questions from Blackburn?
Not today, thank you.
CTV?
Yes, good morning, Teresa. How are you today?
Good, how are you?
I'm good. It's sunshiny outside. It's wonderful. So, hey, in the news today, the public board is revamping their website and hiring an extra staff member to kind of engage and send out messages to the public. I guess it's to improve the infrastructure. So when you hear about things like that, especially during the pandemic, I mean, change is important, and it's good to see someone is reacting to, you know, the change, right?
Yes, if you're asking me to agree, I think all along the pandemic, we have done that ourselves at the health unit, is as more information becomes available, better, ways to do things, improvement in operations. I think we've done that from the get-go, and I would assume the schools are doing that as well to make sure that they're meeting the needs of their school population.
Do you think the schools in general, like, you know, all the boards have done a good job in communicating, I guess, the messages that come from you and wherever else?
I think that our health unit is still working through to make sure we're giving the proper messages to the parents and to the school principals. COVID can be confusing, and I think because our health unit has been dealing with it for the past 6 months, and it's really become our language, and we're very comfortable with kind of the flow of practices. So we will continue to work with the schools to make sure we're clear with our communication and we're able to support them. And but we have a good relationship with all of the school boards, so I can only anticipate that if there's need for improvement, we'll work together to make sure the communication is there and is enhanced if it needs to be.
Okay, great. Thank you.
Any further questions from the Windsor Star?
No, thank you.
CBC?
Yes, just one question to follow up here, Teresa. There was a big car meet that happened over the weekend on Tecumseh Road in Dougal, despite the new restrictions on gatherings. Just wanted maybe your thoughts on that.
I think the public health messaging has been pretty clear all along, and the gatherings and in large groups, not physically distancing, not wearing proper masks can increase the risk of spread. And so these types of gatherings do put us at more of a risk, and people that are attending have a responsibility to determine their risk and to do the best they can to protect their community and the people around them. I don't know specifically about this, gathering other than what I saw in the news, but I think it's something that all of us have a responsibility to look at our role and what we're doing and what we're engaging in to protect our community as we see increased numbers across the province. And we still are in the middle of a pandemic, and the public health measures of physically distancing and now wearing a mask, they're very important, and those messages haven't changed. So safe gatherings are allowed, and there are changes for reasons, and I would definitely support those changes.
Thank you so much.
Any further questions from Amy Hundred?
I am good, thank you.
Blackburn?
No, thank you.
CTV?
I'm good. Thanks. Have a good day.
Thank you. Bye now.
Thank you.